So who do we prescribe SSRIs to? What type of women? Well, 13-year-olds who are going through puberty. The after effects of hormonal birth control. Breakups, loss. We prescribe SSRIs for other medical conditions that go undiscovered. So the harm of this goes much greater than what we're just discussing today because it stops investigation.
To the puberty point, these are not just your typical teen that's moody because they're undergoing puberty. These are teens that are very much struggling. And by saying this, you're shaming these parents and these kids for going this route. Even you're shaming these parents for trying to help their child the best that they can.
Oh my gosh, I accidentally deleted the video clip that was supposed to go here. Anyway, he's trying to paint a picture here that SSRIs are being prescribed for things that should be thought of as normal human experiences. So girls going through puberty, people going through breakups, when you've lost somebody, this maybe, somebody close to you has died. And yes, those are definitely normal parts of human experience. And there certainly may be some cases where we over-medicalize those things and maybe the person doesn't need a diagnosis or a treatment. However, there are still some people that will struggle so greatly with those things that yes, they do need some form of help. And yes, that might be medication. I do think he brings up a good point, though, about using SSRIs and it ceasing investigation. I can certainly think of lots of women who have gone to the doctor with all sorts of complaints and they're not feeling well and they're not living their best life and they're basically brushed off as having anxiety or having depression. And then maybe several years down the road, it turns out that they actually did have some other diagnosis that went undiscovered. So I do think that that's a very valid point.